Welcome to your preoperative instructions. We are excited to guide you through your preoperative instructions for your upcoming lens replacement surgery with Dr. Neil. Your procedure will be performed at our private outpatient surgical center, conveniently located in Anaheim Hills. Anaheim Hills Surgical Center, 500 South Anaheim Hills Road. Because you'll be receiving IV sedation during your procedure, you will not be able to drive yourself home afterward. Please arrange for a responsible adult to accompany you to the surgical center and drive you home following your surgery. If transportation is a concern, please let your surgical coordinator know as soon as possible. We are happy to help arrange transportation to and from your home on the day of your procedure so you can focus on having a comfortable, stress-free experience. In the following sections, we'll review everything you need to know to prepare for surgery, what to expect on the day of your procedure, and how to care for your eye afterward. Our goal is to make sure you feel informed, confident, and completely prepared every step of the way. 3 days before your procedure, please begin using your prescribed antibiotic eye drops at home. Depending on your prescription, this may be ofloxacin, moxifloxacin, or catifloxacin. These antibiotic drops help reduce the amount of bacteria on the surface of the eye and prepare your eye for surgery. If you were prescribed a combination eye drop, you do not need a separate antibiotic, as the antibiotic is already included in that medication. In that case, simply begin using the combination eye drop 3 days before your procedure as instructed. Please place 1 drop into the operative eye 4 times a day while you are awake, beginning 3 days before surgery. Continue using your drops exactly as directed unless we instruct you otherwise. If you have any questions about which eye drop to use or how to administer it, please don't hesitate to call or text our office. We're always happy to help. Because you'll be receiving IV sedation during your procedure, our anesthesiologists ask that you do not eat or drink anything after midnight on the night before your surgery. This includes water, coffee, gum, mints, and candy, unless you have been given specific instructions otherwise. On the morning of your procedure, please take only your blood pressure medication with a small sip of water, unless you have been instructed differently by your physician or anesthesiology. Please wait until after your procedure to take your other routine medications. If you take blood-thinning medications, such as aspirin, Plavix, Eliquis Xarelto, Coumadin, warfarin, or similar medications, please follow the specific instructions we have provided regarding when to stop them before surgery. Always do so only with the approval of the physician who prescribed the medication for you. If you have any questions about which medications you should or should not take before surgery, please don't hesitate to call or text our office. We're happy to help ensure you're fully prepared for your procedure. On the morning of your procedure, please wash your face thoroughly before arriving at the surgical center. It is very important that all makeup be completely removed, especially around your eyes. Please take extra care to remove all mascara, eyeliner, eyeshadow, and any other eye makeup from your eyelids and lashes. In addition, please remove any foundation, concealer, or other facial makeup. Arriving with a clean face and eyelids helps us maintain a sterile surgical environment and reduces the risk of infection, giving you the safest possible experience. When you arrive at the surgical center on the morning of your procedure, our nursing team will welcome you and begin preparing you for surgery. One of the first steps will be placing a small IV in your arm or hand. This allows the anesthesiologist to give you medication during the procedure to help you feel relaxed and comfortable. After your IV is placed, our preoperative nurses will begin administering several different eye drops to prepare your eye for surgery. These include an antibiotic to help reduce the risk of infection, anti-inflammatory drops to minimize swelling, and dilating drops to enlarge your pupil so Dr. Neil has the best possible view during your procedure. These eye drops typically take about an hour to reach their full effect, so you will spend most of your time that morning relaxing in the preoperative area while we complete these final preparations. Once your eye is fully prepared, you will be brought into the operating room and comfortably positioned lying flat on your back on the surgical bed. Dr. Neil will then perform your procedure. Most patients are with Dr. Neil for approximately 20 to 30 minutes, although the exact time may vary slightly depending on your individual case. After your surgery is complete, you will be taken to the recovery area, where our postoperative nurses will monitor you while the sedation wears off. Most patients spend about 30 minutes recovering before they are ready to go home. The remainder of the day should be spent resting at home. Please leave your eye patch in place until we see you the following day. Before you leave the surgical center, you will receive detailed written post-operative instructions explaining everything you need to know about caring for your eye. We will see you back in our office the day after surgery to examine your eye, answer any questions you may have, and make sure your recovery is progressing exactly as expected. Thank you for entrusting us with your vision and your eye care. We truly appreciate the confidence you've placed in our team, and we are committed to making your surgical experience as comfortable and successful as possible. If you have any questions before or after your procedure, please don't hesitate to call or text our office. We're always happy to help. We look forward to seeing you on the day of your surgery and helping you achieve your best possible vision.